Hi! It's so nice to see everybody out here defending Medicaid!
Woo!
I'm Rachel Fox. I'm a medical student, and I'm with Students and Physicians for a National Health Program where we where we advocate for a universal, comprehensive, single-payer healthcare system. I used to work in Medicaid financing before med school, and I'd like to tell you a story from that job about how Medicaid saves lives and can save money in healthcare spending in the long run. So, one summer, a hospital contacted my team about a little boy who had well-controlled asthma for the majority of the year, but in the summer he was going to the emergency department multiple times every week with asthma attacks that were caused by the summer heat and humidity because his family couldn't afford air conditioning. So we got him a $100 AC unit for his bedroom window, courtesy of his state's Medicaid program, and his emergency department visits dropped to almost zero.
Woo!
Woo! That $100 Medicaid claim ended up saving hundreds of thousands of dollars in healthcare spending and allowed that little boy to have happy, healthy summers.
Woo!
And that's just one of a million examples because Medicaid is critical. It's flexible enough to meet individual states' needs, but it's broad enough that every single hospital in the country receives Medicaid funding. It covers innocent kids struggling through the summer break due to their asthma, and 40% of kids in general. It covers new moms and their babies, elderly folks at nursing homes, people living with disabilities, first responders, veterans, people trying to escape poverty, and students like me and half of my med school class. Does any of that sound like waste, fraud, or abuse to you? No, me neither. So, since this administration and their douchebags seem confused about what counts as smart spending, let's give them some examples of what actual waste, fraud, and abuse would look like. Waste would be Trump spending $18 million in taxpayer money to play golf for over a quarter of his days in office. Boom. Fraud would be Medicare Advantage, not traditional Medicare, which we love, but Medicare Advantage, which is run by private health insurance companies and is under investigation for overcharging the Medicare Trust Fund while providing worse services for their enrollees. Boom. Paying more for less is only an advantage if you're a United Healthcare shareholder. And abuse would be Elon Musk, our national parasite, leeching off of our government to get even richer. Boo! So let's tell Congress to work on cutting actual waste, fraud, and abuse instead of slashing Medicaid and access to care for the most vulnerable Americans. I feel so fortunate to have you guys on my side, and from all of us at Students and Physicians for a National Health Program, thank you.